Well, for some in-depth analysis on the campaign against AIDS, we are now joined in the studio by Dr. Catherine Sozi. She is the Director of UNAIDS in China. Thanks for joining us on NewsHour today, Dr. Sozi. So we heard some daunting figures just now in the newscast. The first World AIDS Day, we know, was celebrated in 1988. It's been 26 years. Where are we worldwide in this prolonged war on HIV?
Okay, as you said, the first World AIDS Day was commemorated in 1988. So it's a time for remembering, because millions of people have lost their lives, but it's also a time of getting some collection around rejoicing about the achievements, and then a time to recommit. So the achievements have been quite staggering, way beyond what we had initially imagined. We've managed to avert 10 million new HIV infections since 2002. And in addition to that, we're nearly at the target of 2015 of having 15 million people on antiretroviral treatment. Currently just under 14 million. That number of people on treatment has meant that less people are dying. So we've managed to avert 7 million deaths from HIV. And the work around sort of removing punitive laws and reducing stigma and discrimination is ongoing and is much better than it was when we first started. So a great collective effort which has been made by governments, by civil society, private sector, all together at the table. But in spite of these great achievements, the next hill to climb means that we've still got a big gap. And as you said earlier in this show, was that there are lots of people who are being left behind. So out of the 35 million people who are HIV positive, only 19 million of them actually know they carry the virus. Which means that if people don't know they carry the virus, they cannot actually access the services that have been put there with great resources to date, including the treatment itself. But not only that, 2 out of 3 children who should be on treatment are not on treatment. So clearly children are being left behind. There's also evidence of an increasing epidemic in Central Asia, in the Middle East, fueled by stigma and some of the punitive laws that are being put in place, which basically keeps a lot of marginalized people at the margins of society and not able to access the services. So we've still got a lot of weight. Then UNAIDS is calling for fast track, that by the end of 2030, if we can end AIDS as a public health threat, we're going to have to really gear up and make some paradigm shift in some of the programming to make sure that we reach all the people who need to be included in the good news that we're commemorating today.
All right. Now, just yesterday, Premier Li Keqiang vowed to ramp up treatment and prevention against AIDS. He also said China is open to international cooperation. How do you evaluate China's overall efforts in containing AIDS?
I think that what China has done, and we were able to get together with some international experts earlier on this year, together with some of the scientists and academics in China, to review the state of the epidemic. And most of what you've described is exactly that, is that, you know, there's been significant progress in the results in China, including, you know, the transmission rates in people who inject drugs going down, including in the number of condoms that are distributed, and number of people on treatment at the moment. But I think what is clear is that if China is going to be even better at what it is and contribute to the global ending of AIDS by 2030 as a public threat, they're going to have to shift a little bit or put a gear into what they're doing. For instance, HIV testing, even though they're doing 100 million tests, it sounds a lot. It's definitely the greatest, biggest testing program globally. But they need to test a lot more and test the people who need to be tested. So it means a shift in the protocols for testing. Instead of waiting 2 weeks, 30 days for the results, I want to have a test that is maybe a saliva test, not a whole blood test, and get my results straight away and then be encouraged to start on treatment. China is one of the biggest producers of active pharmaceutical ingredients for antiretrovirals globally. It exports to the rest of the world. But I think that the Chinese people are currently taking up to 5 to 6 pills a day, whereas other parts of the world, including Africa, where I come from, people are on 1 pill a day, which improves greatly how you tolerate the medication and whether you're able to adhere to it. So I think that there are certain programmatic issues that may need to be changed in accordance with that actually the services get to the people in the way that it fits into their daily lives, and that they're encouraged to get involved in this program. It also means that in order to reach people more effectively, civil society organizations, particularly those working in the very communities where people are, need to be resourced or financed to be able to do what we want them to do. They're the ones who have the contacts on a day-to-day basis with people. They're the ones who know where to reach people, how to reach people. And I think that although government can create an enabling environment, it can't do everything and needs everybody in place. In addition to that, I think that there are certain issues around the laws and regulations that could change. For instance, there's an excellent program being done on condom programming, where male condoms are provided to people who sell sex, whether they're female, male or transgender, gay. But I think that, if you're found to be carrying a condom at the moment, you can risk that condom can be used against you in courts. So I think there's certain things that can be balanced out to try and encourage people to protect themselves, to protect the people they relate with, and participate in enhancing their quality of life together.
All right, Dr. Catherine Sozi, thank you very much. But stay with us. I have a couple more questions for you coming up in just a few moments. Well, now let's